You might remember receiving an email last year asking for your participation in the College of Health and Human Sciences Diversity, Equity, and Inclusion Needs Assessment. From September to October of 2021, the College of Health and Human Sciences students, staff, and faculty participated in surveys and interviews about their perceptions of DEI efforts at SJSU and needs that they identified. This is a brief overview, but for the full report and the College Action Plan, see the links that are provided in the description. The 13-item survey was emailed on September 7th and remained open through October 28th. It included open-ended questions with additional multiple choice and ranked choice items. There were also 2 focus groups, 2 faculty meetings, and one-to-one meetings with staff. We had 191 respondents, and the majority were students, so we'd like to thank you for taking the time to share your experiences. Public health and recreation, nursing, kinesiology, and social work were the top 4 departments responding. The findings and recommendations for the report were organized according to the 4 domains of the Inclusive Excellence Ecosystem Model, which is adapted from the Framework for Diversity in Higher Ed. I'll share the main findings, a sample of quotes, and end the report with recommendations that were made to the college departments to address our respondents' top priorities. The first domain, institutional viability and capacity, involves infrastructure, resources, and support that are allocated for DEI. Many respondents were unaware of DEI-related activities, and many who were felt they were insufficient. Employees and students were interested in moving from discussion to action and identified several policies that might need to be addressed, such as clinical dress code, and were also requesting clarity regarding processes for reporting incidents of bias and discrimination. The quotes you see here are a sample of those included in the report. They identify not just the need for action, but also interest in engaging faculty, staff, and students who haven't previously been involved in DEI-related activities. The second domain is access and success, and it represents equity of opportunity in admissions and hiring for underrepresented students, faculty, and staff. It also includes policies and interventions that help to retain and support their success once here. The themes that arose pertain to recruitment, student advising needs, supports for students, admissions, and shared power. There were wide variations in the perception of diversity, and as a result, also wide variations in how successful we think we are. So those who consider diversity as representation of non-white students, faculty, and staff saw SJSU as quite diverse, whereas those who consider the lack of representation in certain affinity groups like Black, Latinx, or LGBTQ populations see a lot of room for growth. The last quote is a portion of a longer one shared in the full report that I think is worth a read. While we might not be able to impact this larger structural inequity within the College of Health and Human Sciences alone, it was a recommendation included in the university's DEI report, where the recommendation was made for diversity champions who could be trained to sit on various hiring and other types of committees that are typically lacking in representation. The third domain is climate and culture. It involves creating an environment that values diversity and promotes a sense of belonging. Responses were mixed in this domain as well, and it reflects that people within and across departments have very different experiences on campus. So quotes were included to represent both experiences, to validate that it's possible for both to exist in the same space and one doesn't negate the other, but to be an environment that supports the inclusion of all members of our community. The recommendations in this domain are aimed at helping to create an environment that engages all and values the richness that diversity brings, and that includes underrepresented groups. Respondents expressed interest in improved communication, affinity groups, and community engagement, which was another aspect that aligned with the university DEI report. The quotes identified opportunities to improve our communication in the classroom, in our meetings, and expressed interest in promoting mutual respect by getting to know one another better. The fourth and final domain is education and scholarship. It pertains to faculty members' ability to apply principles of inclusive teaching in the learning environment in a way that addresses diversity in the profession and with regard to the clinical populations that we serve. There was a lot of interest in working to integrate DEI into our curricula, to continue with our education program regarding anti-racism and other learning opportunities. Many faculty were interested in, engaged in, or would like to engage in improving their teaching, but felt they lacked the time, knowledge, resources, or coordinated effort within the department to do so effectively. So the following recommendations were established based upon these findings, and an action plan was developed. The report was shared along with the findings and suggestions for follow-up to the departments through the college, through the SEED committee and its representatives. One of our first objectives was to establish DEI committees so that there will be staff and faculty who can do the work. And for you students who participate in governance and committees, you can have a role in that as well. So if you see that there's a way to integrate any of these recommendations into your work, in your committees, your student groups, please feel free to raise those concerns. The second half of the recommendations are detailed here for your review. Remember that you can access the full report using the link in the details, as well as the suggested action plan and goals for the next year. Now, in response to some of the most specific issues raised, such as incident reporting, the Office of DEI shared this information. The link for the form to report bias and discrimination is in the next slide, as well as linked in the description. If you submit a report, you will be contacted within 3 business days to meet with a consultant from the Office of Diversity, Equity, and Inclusion, who will provide you support and inform you of next steps. You can see that the follow-up will then vary depending on the type of incident that occurred. And the other specific issue was about the dress code in nursing pertaining to head coverings. And an update to that is that the School of Nursing director has been informed of these findings. She has appointed faculty to the Faculty Affairs Committee to address issues pertaining to diversity, equity, and inclusion, and we plan to raise that issue in the month of February. Thank you again for your time and responding to the survey. If you have additional insights to share, I'd be happy to hear from you. You don't have to wait until the next survey rolls around. You can contact me by email at any time if you'd like to make a suggestion, express a concern, provide more information, or to be involved in any of our collaborative work. I hope you'll be in touch.